Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and I'm going to make yet another jaw surgery video. I don't have that many because it's not something that I help doctors with, although I do like to educate doctors about what it entails so that when they're giving their diagnosis and their treatment plan, if they're doing a compromised treatment plan and if the best outcome is jaw surgery, that they can at least mention it. You have to mention it, and you have to mention the benefits. And if you are not comfortable mentioning the benefits, you really, and if you don't understand why, you should go into American Dental Association's policy on this. Um, it is your job, if you're going to do orthodontics or even any sleep treatment or anything, to make sure the patient understands all the options. Even if you're only offering one more limited option, you have to explain all the options. If you can't explain it, it is not standard of care, which could get you in trouble. So then you do need to refer out to somebody that can explain it. So it's a good idea for you to get trained up on at least the basic explanation. It's not like you could look at a patient and be like, yes, you will need this kind of surgery. I don't know what type of surgery you need. I don't know if you need one jaw, two jaw, MARPI, this, that, SARPI. There's so many different ones. That's the surgeon's job. It's my job to say, look, I know that surgery is going to get you a better outcome. Your face is going to look better. Your function is going to be better. Your airway is going to be better. Your vitality is going to be better. Everything's going to be better. Tongue position, myo, everything. And a lot of times people think surgery, dude, it's a day surgery usually. It's like outpatient. It's not that big a deal. And nowadays with plates and everything like that, it's it's not that bad. It's not that bad. And sometimes they can just do things with distraction and mini implants and stuff. So, and often if the patient has major issues that compromise vitality, in terms of eating, speech, function, airway, significant enough, they can get it covered by medical insurance and they can have just a way better outcome. So we want to make sure that we're understanding it so we can explain it. So let me tell you a little bit more about kind of the 2026 airway and aesthetic focus orthognathic surgery. It's not the orthognathic surgery I was trained on, 2 dozen years ago. It's really a big shift. And it's all about facial harmony, and they're not just treating to Ceph norms. Before it was like Ceph norms that were standardized numbers as well. We just go to that. I think now that they can do the plates, they can move things much further than they could before. So they are looking usually more airway, more full, and everything like that. So their goal is to use CBCT imaging to maximize the pharyngeal space by advancing the maxilla. So a lot more surgeries are two jaws. A lot of time when I was in residency, a lot of surgeries were one jaw because they weren't always using plates and screws. They were using doing smaller movements and using just ligation and things, to set it. So that's pretty much it. I mean, there's a couple different options in the surgical techniques, and granted, I'm doing my own research on this because last time I was in a surgery or assisted with a surgery, it was like 2003. So you've got your MMA, or maxillomandibular advancement, where both jaws are being moved to open the airway and provide better soft tissue and support for the face. You've got your CCW, or counterclockwise rotation, where rotating the jaw complex forward and upward. So taking the maxilla, and we're basically canting it. So it increases airway space, and improves the projection of the chin and lower face. We got genioplasty, which is a chin surgery. Usually it is to help to augment the chin, but sometimes people get them shaved as well as nasal management and things like that, using a suture to prevent the nose from widening as we advance the jaw or expand the jaw. So all these things are helpful. And ultimately, functionally, it can help to improve OSA. Aesthetically, they're going to look way more youthful. They're going to be able to talk better, eat better, function better, and everything like that. So please send your patient for evaluations before you do a compromised care, especially in class 3 and in class 2 cases. All right, thanks so much.